alkaline environment, and it requires some metal ions, and the most important metal ions for this enzyme is the zinc ion. We have some other compounds that can inhibit the activity of enzyme. Remember, the name of these inhibitors is not important, okay? These are just for more information. And about the, the constituent of the metal ion, you should know that the zinc is important. But about the other that considered as an activator, as an inhibitor, these are just for more information. And I review these points. We have this enzyme in several organs. For example, we have a liver specific of this enzyme, bone enzyme, especially osteoblast cells, okay? Because we have an osteoblast. This is related to the osteoblast cells. And we have a placenta, so especially during the third trimester of the pregnant women, because we have a large size of placenta, they produce a normal amount of them. Alkaline phosphatase, maybe you think that this is related to some disorder, but because they originated from the placenta, is considered as a normal finding. And also we can find in intestine and kidney. And about the exact function of this enzyme is not understood yet, but it is related to the lipid transport in the intestine, and also it is most probably very related to the calcification in the bone. I review these points. We have a different type of enzyme. They catalyze the same reaction, but they have some characteristics. For example, they have a different carbohydrate content. They have a different electrophoretic mobility. They have a specific characteristic. And also they have a specific tissue distribution. They consider as an isoenzyme or isoform. Alkaline phosphatase contain different isoenzyme. Intestinal I, tissue non-specific because it's most important for the liver, give the L, alkaline phosphatase, L and placenta. We have a different type of this enzyme. About its significance, as I mentioned, the serum enzyme of alkaline phosphatase is very important in some liver disease, like hepatobiliary disease, and also not only liver, but also bone disease are considered as a clinical significance of the measurement of this enzyme. For example, in a cholestasis of the liver in bone disease, because we have some alteration in activity of some cells, we have alteration of this enzyme. As I mentioned, for interpretation, because the normal range of this enzyme can affect by many factors, like age, like gender, race, and also blood type can affect, and also pregnancy, because we have a placenta origin. You should consider all these factors if you want to interpret the result. Abnormal level of this enzyme found in a gallbladder, kidney tumors, infections, and some malnutrition. These are related to this one. This slide is very, very important because for your final exam, some part of your final mark is from the practical session about the presence, absence, and about the findings you write in your papers, okay? And another part of your final exam is from the introduction, the principles, and also some clinical importance, okay? The procedure, you don't supposed to memorize the procedure, okay? I don't know how many milliliter add to, for example, reagent 1, reagent 2, you don't suppose. These are just necessary for the experiment, to do the experiment. But about the final exam, the introduction and some principles that are important, I will mention during my speech. For example, this slide, at least one of the final questions about the alkaline phosphatase would be from this slide. You should know that in which situation you have a high concentration of this enzyme, and sometimes you have a low concentration of this enzyme. Whenever you have a problem with the liver and gallbladder, like hepatitis, cancers, and blockage in the bile duct, and also we have a liver, some problem like gallstones and cirrhosis, you have a high concentration. These are related to the liver and gallbladder. About the bone, rickets, bone cancer, Paget disease, and as I mentioned, because parathyroid hormone can affect our bone in any situation that can increase or decrease the concentration of parathyroid hormone, they can affect the concentration of these enzymes. In a very rare situation, these are not very common, in a very rare situation like heart failure, kidney cancer, bacterial infection, and some malignancies, we have a high level. But most of the time, as I mentioned, bone disorder and liver are related to this enzyme. And the low level are also important. About this situation, we have a high level, but whenever you have a malnutrition, for example, you have a celiac disease or deficiency in a certain vitamins and minerals, all of this situation, for example, if the normal range is from, for example, 55 to 100, the finding at this situation regarding to the malnutrition, deficiency of minerals and vitamins, for example, the activity is 20. Okay? The normal range is start with 55, but the patient contain only little amount of this enzyme. So this is related to the malnutrition or other deficiencies. About the normal range, and again, you don't suppose to memorize the normal range because each factory, okay, generally we have a normal range, but we have a little alteration between factories. For example, I bought kits, I mean that, do you know what's the meaning of kits? We have a combination of different reagents to determine, for example, the LDL, HDL, fasting blood sugars, I don't know, urea, creatine. These are the containing of the different reagents, and this is known as a kit, okay? For example, you bought from, for example, Merck manufacturer. You bought from Sigma manufacturer. These are the different name of manufacturer. And maybe there is a little difference between normal range according to the procedure of that factory. So you don't supposed to memorize the normal range. All of the time you have a normal range in front of the result. Okay? You can interpret very easily. You can compare with the normal range and you can guess it is higher or lower than normal range. So normally it starts with 20 to 100 international units per liter. It can vary. As I mentioned, because the age is the age is the factor that can affect the concentration of enzyme. So as you can see here, we have a different normal range, for example, for the male and also for the female. Age and gender because can affect. For example, this normal range is for 20 to 50 years old of the male, or actually man. And also this is a normal range. As you can see here, there is a little difference between normal range about women. And also pregnant women normally have a higher than normal range. So, because it is as the origin of the placenta, it is not related to some pathological situation. And for example, normal value for the patient who are older than 60, as you can see here, the age can affect. This is up to 50 years old, this is older than 60. There is a little difference. All of this normal range will mention in front of the results, okay? So you should just know that age and gender can affect the normal range. What you don't memorize, because each laboratory have a different normal range. How we can measure the activity of this enzyme? This is enzyme. So if you provide a specific substrate for this enzyme and you provide a favorable environment, you can have a proper activity of this enzyme. What is the substrate of this enzyme? The name of substrate is important. Maybe I ask you, which of the following is the substrate of the alkaline phosphatase? Para-nitrophenyl phosphate, or PNPP. Okay, with the abbreviation of PNPP. This is the substrate of the alkaline phosphatase. As you can see here, this is a colorless, it's like water, okay? This is a colorless reagent. Following the reaction of the alkaline phosphatase with the proper environment, we produce another compound, and this produce the yellow, especially when we provide the alkaline environment. In an alkaline environment, the final product would be yellow, okay? Very light yellow. So you can read the absorbance by the spectrophotometers. So the reaction is monitored by the measurements, the rate of increase in the absorbance. Which nanometer? 405 nanometer. So you should follow. It means that we measure the activity 2 times, okay? And we should record the 2OD, optical density or absorbance, if we want to measure and calculate the activity of the enzyme. We require 2 reagents. For example, number 1 reagent contains this compound and reagent 2 contains a substrate. About this slide, just the name of the substrate is important, okay? And for example, we have some preservative, I don't know, diethanol to provide the alkaline environment. These are not important. You should just know that we provide it because we want to measure the alkaline phosphatase. If we measure the activity of acid phosphatase instead of this reagent, it's better to add the acidic compound, okay? But because we want to provide the alkaline environment, so the pH is alkaline or basic. And the name of substrate is just important. We can do this procedure by 2 ways. We have 2 types of methods, monoreagent method and 2 reagents. For the 2 reagents, we require number 1 reagent, and after mixing, you add the number 2. Maybe it's a little complicated, so I asked from Mrs. Haddadi to provide the mono reagent because it's very easily. For mono reagent, at first, we mix it. Please take a picture from this procedure because it's important.
What does working solution mean?
Working solution is here. For the 2 reagents, at first, you should take from reagent 1 and 4 times from, for example, reagent number 2, okay? 1000 microliter reagent 1, 250 microliter from reagent 2. In a simple way, in a simple method, Mrs. Haddadi mix the reagent 1, 4 portion of reagent 1 with the 1 portion of reagent 2. For example, 1 from 4 milliliter and mix it. Now it is ready to use. And this solution known as a working solution. So, working solution is the combination and mixture of reagent 1 and reagent 2. It is ready to use, okay? Because I want to facilitate the procedure, so I asked from Mrs. Haddadi to mix it. So, after adding 1 milliliter or 100 microliter of working solution, you have a serum sample, okay? After taking 20 microliter, you should mix your content of your test tube, and immediately, actually, after mixing, you should set the time. Time is very important. You should consider that in any experiment that we measure the activity of the enzyme, time is critical, and you should work very precisely. So, after adding working solution to the serum, read the absorbance after 1 minute, okay? I mix it and I set the time. Follow. After 1 minute, read the absorbance. Okay? This is OD number 1 or absorbance number 1. You should continue. You should continue and take the time by the chronometers after 3 minutes. Okay? So you should read the absorbance and determine and record the absorbance.
So OD1 is after 1 minute of mixing it well.
Yes.
And then OD2 after
For
3
example,
minutes.
this is. You know. You added reagent to the serum. Okay, this is 0 time. Okay, you should continue
1 minute.
after 1 minute. Okay, you should write OD number 1 or absorbance number 1. Okay, you should continue the procedure. 2 minutes is not important. Continue
3 minutes.
3 minutes. So the total time is
3 minutes.
3 minutes. Okay? Again, you write OD number 2. Okay? And you should calculate the OD difference.
Delta.
And it is delta OD. What is the time difference?
OD number 2.
Is 2. Okay? You should put in the formula, and also for each enzyme we have a specific constant. This value is constant. For example, for alkaline phosphatase, this is constant. For creatine kinase, we have another value. And according to this formula, after multiplying to this value, you should calculate, okay? And please, whenever you write your result, you should put the units. It is a unit per liter, and in some laboratory they report as an international unit. Without unit, you cannot get the mark. Okay? Please write the formula in your paper, and also, for example, maybe you reported 99 units or international units per liter. And according to this normal range, please tell me, we cannot determine between, distinguish between male and female. Just please report this is normal, higher than normal, or lower than, okay? Please write your interpretation.
But
So, what should you write? Formula. The final value, unit, and your interpretation. This is normal, or increase, or decrease. Okay, according to this normal range. Okay?
Okay.
We can go to
If we don't know the gender, how are we going to tell if it's normal or not? No, she said like it doesn't matter if it's male or female.